to our first call to the public, and I don't see anybody here to speak. So that will take us to our agenda items. Item A, I would entertain a motion to approve the appointment of Teresa McKay to the Shiawassee County Jury Board.
So moved.
Support.
We have a motion and support. Are there any questions or discussions? All in favor of moving this to tomorrow night, signify by saying aye.
Aye.
Any opposed? All right, that moves forward to Wednesday. And item B, approve the proposal from Michigan Association of Counties for opioid strategic planning. Is there a motion?
I'll make a motion.
Second?
Support.
All right, we have a motion and support. Discussion. So I can give some background on this. Dr. Boggs and Chairman Brodeur and myself met with Amy Dolinke, who was here and presented a couple of months ago or last month about the opioid settlement. She works for the Michigan Association of Counties. She is the specialist that they have brought on to help counties provide technical support and that sort of thing in spending the opioid dollars that we're going to be getting. One of the things we talked with her about was doing a strategic plan. This would involve assembling some meetings of community stakeholders, starting with one meeting. I don't know how many meetings, but to get input about what the needs in our community are regarding using this money in a way that will address our opioid and other substance use problem. And so this would be at no cost to the county. It is the decision of this board how those dollars are spent, so this would come just as a recommended report, that this would involve law enforcement, courts, it would involve substance use providers, organizations like Catholic Charities and the Prevention Network and because a lot of them have said, hey, how are we going to use the dollars? And so our idea is to hear from all of them and come up with some suggestions to be made to this board, and then this board would decide how to spend the money. We could go with their plan or do something totally different, but I certainly think it would be worth getting input from our community stakeholders.
Is this new money? Is this money we got left now?
This is the opioid dollars, so some of it we have already. We haven't spent much of it, except I think some of it's been used for some of the planning things around the Community Corrections Advisory Board, maybe for the Pretrial Services Office. I'm not sure about that. Brian's not here to give us a report, but I think a little bit of it has been spent for some cost, but we have some of it and there's more coming from what I understand.
It'll be about $200,000 a year for 18 years. We don't have an exact number yet, but it will come with various restrictions on what we can do with the money. We can't just throw it into our general fund. And the rules.
We can't have parties and nothing, no?
80% of it has to go to future opioid use abatement or whatever, for lack to address some of it could be used for, I think it's not 15%. A certain small percentage of it can be used to reimburse the county for costs that have been incurred because of the opioid crisis, like something at the jail or law enforcement or that sort of thing. But 80 or 85% of it has to be spent on a future plan. And so the Michigan Association of Counties is keeping track, and honestly what the restrictions on that money are, correct me if I'm wrong, Greg, but it seems like there's some administrative rulings and legislation that is still kind of in flux about what you can do with that money.
There are, and I'm sure we'll discuss this more tomorrow when the whole board is here. We'll also have Eric here because the MAC person kept referring us to our corporate attorney.
Right.
So we're going to have a discussion tomorrow also with Eric,
right,
and probably explain a lot of this further,
yeah,
and explore this more.
He's got into it real deep then? He knows all about
no,
it,
but the
Eric?
statute requires that your own corporate attorney be your legal advice basically on how this money can be spent.
We'll find out how much he's had time to
Not
look
the
into it, or
statute
what we
or whatever it
even
is.
know
Oh,
yet,
Yeah.
because my strong suspicion is the state hasn't fully worked out what the rules are gonna be yet. Which
But,
is probably a
right.
good reason for us to be holding on to the money.
right,
We don't wanna spend money and
yeah.
then find out we weren't supposed to spend it that way.
And I think also a good reason for us to partner with MAC, because they do have this person in their office in Lansing who's keeping track of that legislation kind of on a daily basis as it changes. That's part of her job. So she would be the one that would lead us through this planning process to get input from community stakeholders to make recommendations to this board about how to spend the money in ways that would be in alignment with whatever regulations the state puts in place around it.
I guess a question I have is, Commissioner Webster, you talk about a board. That's a separate, you're not referring to us as the board.
No, this board. It is this board's decision to decide how to spend the dollars. So what I'm saying is if we do a strategic planning process, that group is not gonna make the decision about how to spend the money.
No, I understand that, but what you said, I think of us as the commission.
Oh,
When you use the
Okay.
term board, I
Okay.
thought you were talking about a board, you're not talking
no,
about.
Board of
that.
Commissioners,
So
yeah.
their input would be directly to us.
It'd be to us, and it would be strictly advisory.
Yeah, well, I understand that,
Yeah.
yes. I guess what my initial concern is, we have people on the county level who are dealing, we have employees, departments that are dealing with this issue. The health department people,
Yep.
and then the drug court people in the judiciary. And I'm wondering why we would need anything from outside. Now, I understand that, the MAC, and they do a lot of good work, and they've got this opioid settlement funds toolkit, and it gives a lot of guidance on how we go about and what we can do with the money and what we can't do. I think counties, or local government, not counties necessarily, get roughly half of the money. But anyway, so my thought is that we would turn first to people we already have on board, the health department folks. And I'm on the health department board, and we deal with things related to drug usage and such as that. And I'm just wondering why we would want to have these other groups directly contacting us. I mean, I understand, and I suppose this is kind of sensitive to this commission too, not so much the people that are here now, but when we had the COVID money, I know, for instance, Owasso, I think, a city had a kind of an open forum and people could come and make suggestions, but that was kind of wide open what they were gonna do with that money. These funds, it seems to me, the usage is constrained sufficiently that we know where we have to put it, and, or where we should put it. And so I'm just not sure we need all these other groups coming to us. Shouldn't we rely on the expertise of our
So
in-house people?
my perspective on that is that, first of all these people aren't gonna come to us. We're gonna assemble those individuals that you have mentioned, the health department, the courts, the sheriff's department. Those will all be part of this process,
Yeah.
including maybe other law enforcement agencies in the county. So a big part of the opioid crisis is actually in Owasso. They have some really significant numbers. Treatment providers, the prevention network, those people who are working broadly in the county, that they would have input together with our government officials, to come up with a plan, and we would just get that plan. So we're not gonna hold a forum where everybody comes and presents an idea. All those individuals will come together and come up with an idea that comes from that group collectively.
Does the Wausau and the cities get some too? or
They're
no?
getting some of their own, yeah.
Oh.
Not as much as we're getting, but they're getting some of their own, yeah.
So we mostly just look after county people, or we're gonna look after everybody, or what's the technicalities on that, or don't you know?
So it has to be used in the county, obviously, but it can be used for a number of different things. And we have, like, our prevention network represents entities from throughout the county, including the courts are represented there and those kinds of things. So I think bringing them all together for them to come up with some suggestions to us, it would be just a healthy process.
Is some of that money used for more shots or anything like that too, or don't you know?
That's
that?
what we would talk about.
I
I
mean,
know
just-
Larry has things that he would like to see the money used for. What I don't think is the right thing is for us to say, okay, we're just gonna take this money and we're gonna give some to the courts and some to the health department, and not asking the broader community, and then open ourselves up for criticism that we always just use the money sort of inside instead of thinking in terms of the whole community and allowing our governmental agencies to collaborate with other private entities so that we can come up with the best possible plan. That's how I view that. They would be part of that very much so, and I would assume be a driving force in it. Our government, county level people who work with this. But I mean, even our county people, the courts collaborate with Recovery Pathways and with Shiawassee Health and Wellness, and so even our government agencies are already collaborating with private entities or other government agencies to accomplish their work. So, yeah. So, let's take a vote. All in favor of moving this to tomorrow, signify by saying aye.
Aye.
Aye. Any opposed? Thank you. That brings us to last call to the public. Seeing none, we will adjourn this meeting.
Of the Health and Human Services Committee. Let's please stand for the pledge of allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And this is the opportunity for members of the public to address the commission if they so desire. I don't see anyone desirous of doing so. So we'll move to item 4, the agenda items. 4A, it's a motion to approve the contract renewal with the Shiawassee Regional Educational Service District for hearing and vision screening for an amount not to exceed $15,288, and are authorize the board chair to execute the contract. Is there a motion to that effect?
I'll make the motion.
Second?
Sue. Oh, sorry.
Probably should just come on up front.
Any questions? This is, all of these contracts tonight are renewals. The
first one is with the RSD for hearing and vision screening of preschool age children. So those would be your kids being screened in like the daycare centers or any of them younger than 5. And it's a contract we've had for a number of years. And the RSD hires us to do the screenings.
So you just do the physical screening and the RSD does the whatever remedial.
So we do all the screenings and make the referrals for the child to go to further care if they need it, if we find something. The RASD is just hiring us to handle all the preschool kids.
Okay.
And then we provide a report to them. It's one of the contracts where we actually get paid as opposed to paying.
Okay. Any questions? Okay. All those in favor, do we need a roll call on that?
No, you're on a committee.
All those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay, contract renewal B is in Bravo is with the Shiawassee Health and Wellness for social work services as part of the Perry Schools Child and Adolescent Health Program in an amount not to exceed $86,258 and authorize the board chair to execute the contract.
I'll
Is
make
there
the
a
motion.
to move that forward?
I'll make the motion.
This is a social work contractual relationship that we have with the Health and Wellness for both Perry and Durand. Durand is the next contract. Perry was new on board last year, if you remember. We've had Durand for a number of years. And so both contracts are renewing. We're very happy with the services that the social workers are providing. And we do it through contractual basis, so we're not paying any legacy costs to these employees.
Tom, did you second that, or did you need a second?
You're the one that has to.
Yes. Yes, I did. I'm sure I did.
Okay.
As Perry, you talked about how it's worked well from your perspective. Do we get input from Perry schools and have they been pretty satisfied?
Yes, very satisfied. They're very thankful for it because there's a shortage of these counselors in the school districts, especially with all the mental health issues that are going on. So we're very happy to be able to have 2 school wellness programs in our 8 school districts in the county. So we also have a nurse along with a social worker in each district. Now the nurse is employed by the health department and not contractual. Very, very good feedback from the administrators, from the parents. So very, very happy. I wish we could have it in the other 6 districts. I'm working on that.
Okay. Any questions? Hearing none, all those in favor of moving it forward, say aye.
Aye.
Opposed, same sign. How about letter C? It's approval of a contract. It's the same kind of contract, only this one is with Durand schools, not Perry schools.
Correct.
Okay. Any questions about the Durand contract?
I'll support it.
I think you need to read the motion.
Yes.
Yeah. The C is approve the contract renewal with Shiawassee Health and Wellness for social work services as part of the Durand School Wellness Program in an amount not to exceed $86,258 and authorize the board chair to execute the contract.
I'll make the motion.
Okay, I'll second it. Any other questions or concerns? All those in favor say aye.
Aye.
Letter D is a motion to approve the contract renewal with Connie Brown for dietitian services in the WIC program, and authorize the board chair to execute the contract. I need a motion for that.
I'll make a motion.
Second.
Connie has been with us for a couple of years now. She's retired out of Saginaw County WIC program, and she wanted to work part-time, so she averages about 16 hours a week. And she has agreed to stay on for another year, which this is another one where we have a contractual relationship that saves on the legacy costs. And so we're happy to continue her services.
And she will continue in the same capacity and the same number of hours as she's done before.
Yes.
So it's,
Yep, she's a registered dietitian.
no, even though she was always part-time.
Yes.
Any other questions? All those in favor say aye.
Aye.
Opposed? Okay, letter E. Approve the contract renewal with Shiawassee Regional Service District for school nurse services in an amount not to exceed $1,080,000, and authorize the board chair to execute the contract.
Support. I'll make the motion.
Support.
This is our big school nurse contract. This money comes from the state health department. This initially funded through the CDC, but it's pass-through money that comes to the state health department, and we are fortunate to be able to get it for a second year. The difference this year over last is that we've now added Durant to this contract, and they will have a second school nurse. Remember, we have the school nurses under the previous two school wellness programs. This is a second nurse in Durant, and a second nurse in Perry, and a nurse in all other districts. And it is funded fully for another year, and we subcontract with the RESD because they have relationships directly with the schools, so I don't have to bring 9 different contracts. I just do one with the RESD, and they bill me monthly, and we send them the money to reimburse the school districts. I can't tell you how much it's meant to have a school nurse in all of these districts. I've already told the story of Morris, who obviously they can't afford it in their budget, and one of their board members ran into me at a social event and said she cried when they got a nurse in Morris. So I am hopeful that the state legislature finds funding to continue this after next year. We weren't sure we were going to have it this year. We got it for this year. I don't see any more funds coming from the federal government for this, so it will cease if the state doesn't find a way to fund it next year. And all of the school districts are aware of that, so they will have to, and some may choose to continue the hire under their district budgets. Some may not afford to be able to do it. But I'm very happy. This is one of the positives that has come out of the COVID epidemic, was that this additional funding would be available and be able to be put into the school districts. This contract does include the RSD. They are able to have a nurse too that's funded under this money for their special needs students. So really happy with it. Obviously, just a great thing. It's all across the county in every district.
And each school district has its own individual nurse, though.
Correct.
And this isn't the RESD sends them out wherever they need.
No, they have their own individual nurse.
Who are with them the whole year.
Correct. Correct.
Any questions? Okay, all in favor, say aye.
Aye.
Aye. Opposed? It's passed. Forward to the next school meeting. Letter F would be a motion to approve the contract renewal with Convenient Urgent Care for sexually transmitted infection disease services, and to authorize the board chair to execute the contract.
I'll make the motion.
Support.
This is a contract renewal with Convenient Urgent Care. When we have a client that comes in that may or may not have a sexually transmitted disease, we refer them to convenient urgent care to be seen by one of their practitioners, and then we provide the medicine, the antibiotic, or whatever they may need for their treatment under state funding. It's one of the required essential services under communicable disease. And so we don't have a doctor or a nurse practitioner that can see them on our staff, so we contract that out to convenient urgent care. And we've had the relationship with them for probably 5 or 6 years.
Any other questions? All those in favor say aye.
Aye.
Aye. Opposed? That letter F is moved forward to tomorrow's meeting. Letter G is a motion to approve the refilling of a WIC technician at cell grade number 2.
I'll make the motion.
Support?
Yes, we're filling a vacant position that we have in the health department that we've held open for a few years now. WIC's our largest program. In the health department, we service over 3,000 clients. And now, because of changes at the federal level, all services are open to the public in person. So the virtual thing is now ending as we transition away from the pandemic. And so we need to staff up and get that person in there. This is solely from the health department budget.
The county, is it county money or state money?
Well, it's state money to pay for it. There isn't a whole lot of county money in the health
Yeah,
department
that's what I
right now.
I don't know if you were making a
Yeah,
distinction.
It'd be nice if we had it more, but
Dream on.
we do with what we have.
Okay. Any other questions about this WIC salaried position? Hearing none, all those in favor of moving it to tomorrow's meeting, say aye.
Aye.
Aye. Opposed? It is so moved. Call to the public for any comments. Hearing none, the meeting is adjourned.